All right, so today we are going to go over the second half of this anatomy review. Some of these terms I might have talked to you guys about in medical careers, but most of these I probably would think are going to be relatively new to you. If you've taken anatomy at the school, or maybe you're taking it right now, you might either have learned these terms before or you're about to learn them. I don't know exactly what they're teaching you right now, but anyways, same with any medical terminology. It is a lot of memorization, but it is helpful to memorize it because it can give you a big indication as to what exactly is going on, what body part we're talking about, what area. So even if you're unsure, but you know what those terms mean, then you can kind of figure it out. So just remember, you need to make sure that, again, you're listening to the root words. So if you forget, your root words are the words that indicate which body part we're talking about. So like cardi is the root word for heart. And ceph, and again, I don't expect everyone to memorize this. I'll give you an easier one. Like gastro is pertaining to the stomach. So again, those word roots are going to help you figure out kind of location of stuff. And then just again, you're going to have to start memorizing things. And so you should always try to attempt to pronounce terms correctly. I even will hear people pronouncing common anatomical terms, or like even for me for sports medicine terms, a little bit different. But for the most part, you should just try to sound it out. They are typically Latin or Greek in origin, so they kind of sound funky. But once you start practicing, or if you're ever unsure, obviously ask me and I can help you to pronounce those terms. So anatomical position is super, super important for you to understand. This is where I wish I could actually demonstrate what it looks like for you. But anatomical position is how you are going to reference things. So if you don't understand anatomical position, it's going to be confusing, and I'll explain it in a moment. But anatomical position is with the person standing completely upright. Their arms are at their sides. Their palms are facing forward. This is an important part because if you think about how you naturally stand, you don't naturally stand with your hands like that, right? You might stand with your hands at or the palms kind of facing more inward on your thighs. If you don't understand anatomical position, it's going to make things backwards. So you guys will be learning about the difference between medial and lateral. Medial is anything on the inside, lateral is anything on the outside. So if you're in anatomical position, ulna is medial, radius is lateral. However, if you think about how you normally stand, palms are kind of facing inwards, you probably will get confused and maybe think that medial is actually here when in reality it's here. So just keep in mind that anytime I reference anything, you're always thinking anatomical position, so that you're not getting confused. And again, if this is confusing right now, don't worry about it too much, but just keep that in mind. You have different planes in your body, and we'll talk about the different ones, but just know that a plane is a two-dimensional surface defined by 3 points. So we don't really need to fully go in depth with this. Just know that motion, body motion occurs in a plane. So you bending at your waist, that is occurring in the transverse plane. If you were to be standing upright and you were to kick your leg straight out, like your right leg, let's just pretend, kicking it straight out, then that would be movement in the sagittal plane. So again, movement just occurs in these different planes. You have what is called an axis. So this is something that passes perpendicular to the plane. So you have your plane, it's cutting through it, and motion occurs about an axis. So if you can think, you have your head sitting on your vertebrae would then be technically your axis. So for you to turn right and look left, that would be the axis of that. And then again, motion is occurring about this axis as well. So this part is not so important. We're not going to focus on it too much, but just know that, yeah, you have different planes and they allow for different motions to occur. So the different planes, you have your sagittal plane, which sometimes is called mid-sagittal or median, but this plane runs, if you can imagine, splitting your body from one side, like if you were to put a line straight down the middle of your face, going vertically. So it's going to cut right from the forehead all the way down the nose, and just basically putting your body into a right side and a left side. You have your frontal plane, and this one runs from the front or from the top of your head all the way down to your feet, but it's cutting your body in front and back positions. So you have your sagittal, like I said, is cutting you from right to left. You have your frontal plane that's cutting you from the front side of your body to the back side of your body. And then you have your transverse plane, which is cutting you in half. So from top to bottom. So just try to keep those in mind. These things are the more important part. The other stuff about the axis, that sort of thing, we're not going to really focus on too much. So yeah, here's your sagittal, cutting it right and left, frontal, front and back, and then transverse is top and bottom. You have these different axes that are basically where that motion occurs. So again, we're not going to focus too much on this, but just know that they are perpendicular to your planes. You have your anterior, posterior. So what that means is, I was talking about how you have your frontal plane. In order to split your body from front to back, you have to also understand the anatomical words for front and back of the body. So anterior is anything on the front side, posterior is on anything on the back side. And then you have your mediolateral. So that's kind of where those terms that I talked to you about with the elbow, which is basically from inside to outside. And then the longitudinal one, that one is, again, coming straight up the body. All right, so it's important to know the difference between your planes and your axis. One way to help you would just be your planes are usually one shorter word. Your axis is going to be a longer one. So again, remember this is anterior, posterior. These directional terms are super, super important for you to understand because I will be talking about them a lot, especially when we go over the different body joints. Like I said, we're probably not going to get into that right away just because it is a lot of hands-on stuff. But you have what is known as superior and inferior. So superior is anything that's closer to the head or upper part of the body. And then you have your inferior, which is away from the head or the lower part of the body. So if you think about it, and I want you guys to try this with me, straighten out your arm. Your hand, if you were to look, so you're looking at your arm, you're in anatomical position, so your palm's facing up, arm is straight. Your hand is inferior to your elbow. So just know inferior, kind of think of it as below, whereas your elbow is superior to your hand. So same thing if you're thinking, my head is superior to my belly button is inferior to my head. You have anterior and posterior. So anterior is anything that's on the front side of the body. Posterior is anything on the back side of the body. So if I'm talking about my belly button again, my belly button is anterior. If I'm talking about my nose is also anterior. However, my heel, or also known as your calcaneus, is posterior. My glutes are posterior. Sometimes if you know anything about sports medicine, they'll talk about your posterior chain, or if you work out, those are like exercises that focus on the backside of your body. So like your hamstrings, your glutes, your Achilles tendon would be posterior as well. And then you have your medial and lateral terms. So again, let's pretend, keep your arms straight, palms facing up, pinky, medial side of your body because it's closer to your midline. Your midline I think of as your belly button. So which one is closest to my belly button? Lateral, thumb, because thumb is further away from my belly button. Same thing with like your feet. Your big toe is medial, whereas your pinky toe is lateral. And again, if you're confused right now, totally understandable. We'll talk about this more. But again, just trying to kind of give you a little brief, I guess, introduction to these terms. You have what is called proximal and distal. So proximal is closer to the point of origin or attachment. And I'll explain in a moment. And then you have distal, which is further away. So if we're talking about our hip, my hip and my lower leg, my knee is proximal to my hip versus my ankle. My ankle is more distal, if that makes any sense. If you're thinking about your fingers, the tip of your finger is more distal than your wrist. So it's similar, I guess, to anterior, or not anterior, superior and inferior, but just know one means further away, one means closer, and then the inferior superior is above and below. So try not to confuse you guys, but just try to start remembering this stuff. And then you have superficial versus deep. So superficial is anything close to the surface of the body. Deep is further inside. So if I were to skin my knee, that abrasion is superficial because it's not super deep. Funny that I just said that word. Whereas deep would be maybe I have an internal bleeding. So that's going to be obviously deeper inside my body. So this one's a little bit more straightforward, but just know superficial things are things that are closer to the top of the surface of the body, whereas your deep stuff is going to be further deeper inside of your body. You also have these terms, and these are more just general. I don't use them as much. Obviously, you should know what internal means. So internal is more inside of the body. External would be your outer portion. You have your ipsilateral. So this is same side of the body. So if I'm moving my right hand and then I'm also kicking my right leg, that's an ipsilateral movement. Whereas you have your contralateral, which is on opposite sides of the body. So if I were to, let me think, lift my left leg and also raise my right arm, that's an ipsilateral movement because you're doing two different sides of the body, if that makes any sense. You have your parietal, which is pertaining to outer wall of the body cavity. So you have like a parietal portion or parietal lining of your lungs. So that's kind of the area between your actual lung and your thoracic cavity, so your rib cage area. And then visceral is anything that's covering the organ. So like the top surface of the organ, there's usually tissue. That's visceral tissue. So like, again, if we're going back to that lung, imagine your lung is covered in visceral tissue, whereas outside of that, you have that space, and then that's the parietal area. You have different joint actions, and we will be using this throughout the year. You guys actually will be creating a project coming up, and you need to start remembering this stuff. So just try your best. And then if you have any questions, which I expect students probably will on Monday, just feel free to let me know. Maybe write them down. That way I can address them when we're in class. So flexion is just anything that's making a decrease in an angle. So, and then you have extension, which is increasing it. So example of this, if you were talking about your hips, you're standing straight in anatomical position, you bend forward at your hips and you keep your leg straight, that's known as flexion of your hips. Whereas if you were to stand up straight, maybe lean back a little bit, that's going to be extension because you're making that angle bigger. Same thing with your knee. You bending your knee is called flexion because if you look at this picture, that angle is getting smaller. And then if you straighten it out again, that angle is getting bigger. And then you have the same thing. You have flexion at your elbow. You have flexion at your shoulder. You have it at your neck. You have it with your hands, wrists, fingers, so forth. And again, if you have questions, we can go back to this. You then have what is called abduction and adduction. Some people pronounce it abduction, adduction, however it is that you want to pronounce it. I know I said that it matters, but those two are totally fine if you don't want to pronounce it. I call it abduction, but abduction is moving away from the midline. So again, your midline is your belly button and you're moving it away. So if you look at this picture, she is seated. When she brings her foot or her leg outward, she is abducting it. I also like to, and I think I've told some students this, think of it like an alien. What happens if you were to be abducted by an alien? You're going to get taken away. You're not going to be brought closer. You're going to be taken away. So that's a weird way to remember, but that helped me when I was in school. And then you have adduction or adduction, and that's when you're actually bringing it towards your belly button, so towards your midline. So we can pretend, let's say this was her starting position, and then she's bringing it inwards. That's going to be adduction. So I just think of it as you're adding towards yourself. You're not removing it away from you. Not that you're moving your body part, but you're bringing it closer to you. You have your internal and external rotation. So internal rotation is moving it towards the midline. So you're bringing it towards you, but you're doing it in a rotational pattern. So this typically happens at like your hips and your shoulders. It can also happen at your neck. So if you were to look right, you're doing a rotation. When you're looking left, you're doing a rotation. But yeah, just know that if you were to be standing in anatomical position, so palms are facing up, thumbs should be lateral on the outside of your body, and then you were to bring that thumb inwards. So now you're turning your arm and your palm is facing down. That's an internal rotation. Then if you do opposite of that, back to that anatomical position, thumb is out, palm is facing up, and that's external rotation. And I understand it might be hard for you to visualize this because you're obviously not able to physically see me, which again, I can go over this on Monday. You have your supination and pronation. So supination, palms are facing up, kind of its anatomical position. So you're pretending with your palms are facing up, you could probably hold soup. Whereas pronation is when your palms are facing downwards, and that soup now is poured out because you can't hold it up anymore. Last thing we'll talk about is plantar flexion and dorsiflexion. So plantar flexion is when you're pointing your toes, not your toes, but your foot downward. So I think of it as P plantar flexion, P pressing down on a gas pedal. If I've ever stretched any of you in my training room, maybe because you had a calf cramp, but I do this frequently with like football players because they always cramp. But I'll always say, all right, can you just press down like you're pressing on the gas pedal? That kind of gives you a visual as to what your foot's supposed to be doing. So when you're pressing the gas pedal, if you drive, your foot is pointed downwards. Opposite of that is dorsiflexion. So that is when you're actually bringing your foot back. So think of it, foot towards your face. So if you were sitting, your foot is coming close towards your face. So it's kind of bringing your foot as far back towards your body as you possibly can. Oops, I thought that was it. Sorry. You then have inversion and eversion. So inversion is when you bring your foot inward, and then eversion is when you bring your foot outward. So inversion, heel and bottom side of the foot is coming in. Most people actually sprain their ankle in this inversion movement because that's just kind of how your body naturally moves. Eversion is when you actually bring your foot outward. That is not as common, and that's because you have more range of motion when you're inverting versus everting. So it's just more common for people to lose their stability when they're playing a sport and then invert and sprain their ankle. But people can still sprain their ankle this way too. You have circumduction. So this is just meaning around. And so I'm sure you're familiar with this, but you can obviously circumduct at your hip. You can circumduct at your shoulder. It's just a very large movement. So like if you were circumducting at your shoulder, you can bring your arm into like a big giant circle. And same thing with your hip. You can't really circumduct at your knee. Definitely shouldn't circumduct at your head because then that would mean that your neck can go all the way in a circle, which is not good. So yeah, circumduction is typically only going to be at your hip. It can be at your fingers. It can be at your toes. It can be at your ankle a little bit. But again, we can go over this if you are still confused. And I think that's it. So same as yesterday, make sure you're taking handwritten notes. You are using a PDF scanner to then scan these notes. And then also don't forget to write your name on these notes. Don't forget to title these notes. This is going to be lecture part 2. So I would just title it that. And I don't mind too if you're continuing them on your previous day's notes. But again, just get it done before the end of the period. If you have any tech issues, feel free to reach out to me. And I hope you have a good rest of your weekend. Bye.